Breaking news from KHON2, happening now.
Good afternoon and thank you for joining us. Governor David Ige will be starting a press conference momentarily, and with him will be Lieutenant Governor Dr. Josh Green and also Suzanne Case, Chairwoman of the Department of Land and Natural Resources, who has some good news for people who like the great outdoors. A lot more of the state parks to be reopened for local residents to enjoy and get out and about in the fresh air. Before we begin that press conference, we also did just hear from Mayor Kirk Caldwell, who announced a plan to ease some expenses for local families by stretching out the payments of property tax into 4 installments instead of 2. We'll tell you more about that later, but for now, here's the governor.
Good afternoon. The number of cases reported today continues to show that we have flattened the curve. With only 1 new COVID-19 positive case, we are on the right track to get the disease under control here in Hawaii. The low number of new cases is one important metric that we are using to help guide our response to COVID-19. Another key metric is our healthcare capacity statewide. And this is another area where the numbers look promising. With me today is Lieutenant Governor Josh Green, who will provide an update on hospital capacity and his healthcare initiatives. The strong numbers helped us make the decision to begin a careful and thoughtful reopening of our economy. The health of our residents is our highest priority as we make these decisions. Yesterday, under the new Safer at Home order, I announced several businesses and activities that are now allowed to resume operating. Admittedly, there was some confusion in my announcement, and I want to provide some clarification. The businesses and the activities that I announced yesterday can reopen starting Thursday, May 7th at 12:01 a.m. with the following exceptions. As requested by the county, retail stores and shopping malls on Oahu can reopen on Friday, May 15th. Mayor Victorino will be announcing rules related to the opening of retail stores and shopping malls on Maui County later on today. The proclamation also states that child care and business support services such as wholesalers are deemed essential and therefore can begin operations. And nonprofits can operate based on the activity. For example, social services can be offered, but gyms and dine-in restaurants are still not allowed. And as I've said before, while we are developing statewide directives, I also recognize that the counties should have the flexibility to adjust plans to meet their unique needs of their communities. And I fully support the decisions by Mayor Caldwell and Mayor Victorino. Hawaii's economy has been devastated by COVID-19. And while the reopening must be done in a careful manner, we also need to move forward and allow businesses to restart and get Hawaii residents back to work. Today, we have another reopening announcement. With me is Suzanne Case, Director of the Department of Land and Natural Resources. She will be announcing the reopening of selected state parks across the islands. People may use parks for exercise and beach access, but gatherings are still prohibited. I know that getting outdoors is good for people's mental health, and I encourage people to visit the state parks as long as social distancing measures are strictly followed. Things are looking better every day, but we need to remain vigilant. Keep up your social distancing, wash your hands, wear your masks, do all the things that we've been talking about for weeks now. And although I hope people will patronize our newly reopened businesses and get outside to exercise, please remember that it is safer to be at home. So please take care of yourself, take care of each other, and most importantly, help to take care of our community. Thank you.
Thank you, Governor. Our next speaker, Lieutenant Governor Josh Green.
Hello, everyone. Thank you, Gov, for having me. So, we have exciting announcements today. As Governor pointed out, we have one new case, just one new case. And this is something to note because it's been just only a single digit or a low number for the better part of 2 weeks. It has enabled us to have the governor take some strong positions on behalf of our people economically. So we're starting with this brief look about how many cases we have. You should be reminded that our healthcare system has to be adequate before we bring tourism back or bring our economy back, because people could get sick, and that's what we're always mindful of. We have 2,773 hospital beds, but only 1,404 are occupied. That's 51%. This means that we can resume some of the normalcy in our healthcare system, and that we have capacity if we were to have a surge in COVID-19 to take care of people. The national standard is that you always reserve at least 20% reserve in your hospital system in case you have a surge when there's an infectious disease outbreak. Intensive care unit beds are where people who are sickest get care. 112 out of 244 are occupied. That's 46%. Very important, because as people start getting surgeries that have been delayed for elective purposes, or if people are just sick in general, we'll have the capacity to take care of those individuals, and also if we had a surge of ICU need from COVID-19. Ventilators, the largest indicator you've seen me talk about before. This is if someone has respiratory distress. If that occurs because of what's called ARDS, acute respiratory distress syndrome, from any virus, but particularly this one, we would have to put a person on a ventilator. At 14%, we are very, very low, and that's good. That's good news. That means if anything were to happen, any quick change, which the governor would be more than nimble to take care of, we still have a lot of capacity to keep people alive. Total number of individuals who have been hospitalized, 73 over the course of this outbreak. Again, we are in a very good situation because of the order to close our border and prevent lots and lots of travelers here to our state. I know people have often noted the number of travelers that still come in, and though it makes for headlines, and I understand that, please do remember that we used to get 30,000 people per day. In June of 2019, we had 950,000 individuals travel to the state of Hawaii, and now we have a very tiny fraction. We, of course, don't like it when people flaunt our rules, and that's why we have our law enforcement go bust them. Now, another very important number I want to share today is the recovery rate. People have asked, how can we begin to open businesses? Well, 89.1% of our individuals who have tested positive for COVID-19 have recovered. This leaves just about 70 or 80 people total who haven't been cleared after they've had their virus. That means we have a very low viral load in the state. Oh, here we go. Actually, the exact number, forgive me, 68. 68 active cases still. And many of these people have long since left the hospital and been doing well, but we're still mindful that they could be infectious. All of these numbers are meant to underscore the fact that we've done very well. Hawaii, when compared to other states, compares very favorably because of the decisions that the governor has made. Let's talk about how we do compare. 43.6 total cases per 100,000 of our residents. That's how you add up to our 625 or 626 total cases. This is the second lowest case rate in the United States. And we're second only, I believe, to Montana. That's right. And Montana has a very, very sparsely populated state. So as for states that have over 1 million people, we have the lowest rate, and we have a major city here in Honolulu. So I think that's something to note. And probably most importantly is the number of fatalities. At 17, that means 1.2 deaths per 100,000 have occurred. That's the lowest mortality rate in the United States. And that's a very good testament to the hard work that our first responders do, nurses, doctors, our hospital system, the Healthcare Association, really everybody. So this all is meant to preface the reason that the governor was able to announce that we're going to begin to open the Kama'aina economy. And just another couple quick statistics. When we look at our economy, and The governor, when we were chatting just before we came out, noted that about a third of the people have been unemployed and needing benefits. We've talked to our economists, and as much as 60% of the Kama'aina economy, meaning jobs that can come back before tourism returns, our internal economy, our domestic economy, can resume when those jobs come back. And that's very important. Someone asked me the other day, what's the best way to get unemployment taken care of as far as checks? And I said, well, people going back to work. Because I know people want to work. They really want to get back out there. The last thing I wanted to mention today is where we are on the mainland, because it's going to impact us eventually. Now, just yesterday, there was a 20% increase in the number of cases on the mainland. They went from 20,000 to 25,000 cases. So 20% increase in the daily numbers. And that is because they've relaxed very aggressively some of their restrictions in states where they still have a large number of cases. So compare a state that has thousands of cases and it's surging and they relaxed their restrictions versus the state of Hawaii, which had 1 case and very good policies on our parks, very good coordination with our mayors. We sometimes differ, but 99% of the time we're on the same page going forward. That puts us in an extremely good place to make sure that we not only succeeded in phase 1 of the COVID crisis, which was making sure people didn't die and we didn't get overwhelmed, but now in the new phase as we begin to open the economy. So that is the overview. I think you should all be very proud of what you've done, and I'm excited to see how we recover as a people. So thanks for being patient.
Thank you very much, Lieutenant Governor. Our next speaker is Suzanne Case, DLNR Chair.
Aloha. As Governor Ige said, we're very pleased the curve has flattened here in Hawaii, and we're excited that because that allows our DLNR Division of State Parks to reopen select parks and monuments. And so we have very carefully looked at each park to determine which ones could be open really for outdoor exercise with an emphasis on social distancing. We did consult with the Department of Health and the state epidemiologist, Dr. Sarah Park, on best practices that we encourage everyone entering parks to use. Dr. Park told us in general it's a good idea to open up parks to help with people's mental well-being, which we of course fully agree with. The fact that these are outdoor and open-air spaces with good ventilation means the risk of transmission is greatly decreased. There are several very popular parks, such as Diamond Head State Monument, that will remain closed because they're areas where social distancing isn't possible, areas where really the attraction is lookouts or picnic tables, the gathering places or places where people congregate. So where there's lookouts or trails in parks where the 6-foot social distancing recommendation is difficult, we're keeping those kinds of areas closed. But the Department of Health did advise us that, and this is actually very good news for all of us, that as long as people are on a trail moving past each other, even if they're within 6 feet of each other and not wearing a mask, that quick pass outdoors, we wouldn't characterize those persons as anything but low risk at most and likely no risk. That's according to the Department of Health. So again, we're opening state parks to encourage outdoor exercise, certain state parks. Common park activities that are social in nature are closed still. So parties, gatherings, picnics, setting up on beaches, and camping are still not allowed. So the use of the parks is strictly for mobile activities like hiking and ocean use, again, for everyone's physical and mental and emotional health during the Safer at Home mandate. We do want to remind people that all beaches in Hawaii are closed except for active exercise like running and walking and jogging. So you can cross the beach to get to the ocean. You can run, walk, or jog on the beach, but no setting up on the beach, no umbrellas, no towels, no sitting, no chairs. And that's, again, because we're trying to make it possible for everybody to get out and and exercise and enjoy the outdoors in an active way rather than a passive social gathering way. So again, going across to go surfing or paddling or swimming, that's fine, but not sitting on the beach, even beaches in state parks. One thing is we'd like to encourage people to stay close to home. We really think this is an opportunity to get to know your own ahupua'a, the parks in your community, and sort of let everyone spread out rather than driving across the island to congregate in particular areas. Now, the list of reopened state parks or partially reopened is quite long. We have some where the parks are open but the gates remain closed for a variety of reasons. Some where the day-use activities, the day-use facilities are closed. But so to get the status of each park, we ask you to please regularly visit the state parks website, and that is dlnr.hawaii.gov/DSP for Division of State Parks. So please check that on a regular basis. It has all of the detail for every park in the state, every state park, and please keep up checking it because that list will be updated as we go along. Thank you.
Thank you very much, Chair Case. We'll move on now to questions from the media. First question is for Governor Ige. This is from Tim Hurley, Star Advertiser. Hawaii visitor arrivals have been climbing since the start of the mandatory 14-day quarantine for out-of-state travelers. What is the state doing to enforce the mandate, and is there a timeline for lifting that quarantine?
Certainly, we have been working with the counties and law enforcement statewide to develop better systems to enforce the mandate. So we do have people who are checking on the screening process, making sure that they have confirmations for their location of their place of quarantine. For those residents returning, we are calling the residents where they said they'd be quarantined and following up in that manner. So everyone who has been ordered to quarantine, we do follow up and validate. And certainly law enforcement is involved if necessary to enforce the quarantines.
Governor, this is from Daryl Huff, Hawaii News Now. At your press conference yesterday, why didn't you say that Oahu and Maui had different reopening days, and why didn't the mayors of Maui and Honolulu know about it?
You know, certainly we had received proposals from Maui County and Honolulu County, as well as we had distributed drafts of our proposals. And so certainly all of us are sharing information and looking to be aligned as best as we can. And I do believe that that we are aligned in the activities and the businesses that we would allow to be open. Clearly, the state order just enables activities, and businesses are allowed to start, but they are not required to start. They can begin operations at the time that they are ready to do that. And we do understand that every county is different, and so our process does allow each county to consider the conditions that they see in their community and make nuanced changes as appropriate. And certainly the start date of any specific order or any action is one of those things we believe can be flexible as necessary.
Governor, this is from, Eleni Gill, Civil Beat. How did you come to your decision to allow child care facilities to reopen tomorrow, May 7th, and what guidance are you offering to ensure those facilities remain safe for staff, children, and families alike?
You know, certainly the CDC has provided extensive guidance to child care facilities and education facilities from the very beginning of the pandemic. And we do point child care providers to those guidance documents. And obviously, we do require that anyone who chooses to operate within the guidance provided by CDC. My original stay-at-home order did provide for child care to operate for first responders specifically and other essential workers. The amendment made for Emergency Proclamation 7 is the fact that we are asking other businesses to open, and so childcare operators would be allowed to take in the children of those other individuals who are going back to work.
Governor, this is from Ashley Mizuo, Hawaii Public Radio. If child care facilities are open, is there a possibility that we could see public schools begin to meet in person, maybe starting in the summer? What about the public preschool program?
There will be an announcement on public school. I know that the superintendent is working with her team. We are looking at the requirements, making sure that academic requirements for those students who are targeted to graduate this year can be met, certainly, and so look for announcements regarding public schools soon. They should be, especially for the fall, the summer season.
Governor, this is from Rick Kwan, KITV. You mentioned you had already talked to the mayors during yesterday's news conference. So why the substantial changes when the proclamation did not come, when the proclamation did come out later?
There were no substantial changes to the proclamation. Obviously, you can look at the state proclamation, you can look at the city and county proclamation, and there are dozens and dozens of pages long. So certainly coordinating and making sure that all of the contents of the documents are aligned is something that our staffs are looking at all the time. Clearly, we are focused on the big issues of the different proclamations about reopening activities, about which businesses we would consider low risk, and getting agreement on that. Certainly, there are some specific details that we don't discuss in fine detail, and certainly we do believe that the county should have flexibility in some of those areas.
Governor, this is from Melissa Tanji, Maui News. Since there was confusion this time over state and county business openings, what can be done in the future to prevent this confusion?
You know, the mayors and I are meeting 3 times a week, and we do discuss these issues, and we've spent now more than 2 weeks looking at whether the conditions for reopening our economies were appropriate, and at the same time had the discussions about risk assessment of various activities and businesses, and making decisions about which would be low risk and which would allow our economy to be restarted.
And you can continue to listen to this entire Q&A on our website, KHON2.com, where the governor will continue to answer our questions, and we'll bring you all the latest news when our KHON2 News begins at 4 p.m. this afternoon and beyond. A couple of the big takeaways from today: many of the state parks are reopening for exercise, not for camping, not for gathering. There's a link on our website. Some very popular ones remain closed because of the close quarters, places like Diamond Head Monument. So go ahead and check our website for the link to the state parks that are reopening to enjoy the great outdoors. The governor also said to expect an announcement soon from the public school system about possible services that will reopen for summer and beyond. He did not have specifics beyond that, but we'll be keeping a close eye on that, and as soon as we hear, we'll bring you the very latest. Please do stay tuned for all of our newscasts this evening. Thank you so much for joining us. Continue to stay safe.